community-based delivery of healthcare has become increasingly prominent in today's healthcare system. Parallel to this development is an increasing emphasis within the system on maintaining and enhancing the wellness of populations. Community health nurses are in a unique position to engage in roles and activities related to these trends in healthcare delivery. What is community health nursing? The Community Health Nurses Association of Canada describes it as a practice specialty which promotes the health of individuals, families, communities, and populations, and an environment that supports health. The practice of community health nurses combines nursing theory and knowledge, social sciences and public health sciences with primary health care. While community health nursing is an umbrella term that includes such nurses as parish nurses, occupational health nurses, and outpost nurses, the focus in this program will be on the home health nurse and the public health nurse. In this province, home health nurses are called continuing care nurses. The Community Health Nurses Association gives a helpful analogy to distinguish home health nursing from public health nursing. A home health or continuing care nurse begins with a close-up lens, zooming in and focusing on the individual client and family, but then shifting to a wide-angle lens to include groups and various services and supports in the community. A public health nurse begins with a wide-angle lens on systems, populations, and intersectoral partnerships, but then shifts to a close-up lens to focus on the health of individuals and families. Before going on to look at the actual day-to-day practice of community health nurses, it is imperative to set this practice within a broader context. There are various models of community health nursing practice, for example, Anderson and McFarland's Community as Partner model, or the Canadian Community Health Nursing model. Such models serve to guide the practice of nursing in the community. Inherent in the Canadian Community Health Nursing model are 5 standards which define the scope and depth of community health nursing practice in Canada: promoting health, building capacity, building relationships, facilitating access and equity, and professional responsibility and accountability. These standards are applied to practice in all settings: homes, workplaces, schools, and so on. You will see evidence of these standards as the nurses in this program describe their day-to-day practice. The community health nurses featured in this program are either from the City of St. John's, representing an urban setting, or the town of Bonavista, representing a rural setting. Each of these settings presents opportunities and challenges for day-to-day practice.
In an urban area, we don't have as much of a privilege of kind of knowing the key players in a community. For example, in a small rural area, you know, the principal of a school, the minister at the local church, the doctor, the mayor, and the public health nurse, and other key players would probably know who each other are more and have the opportunity to work closer together. Although that can happen in smaller communities within the community of an urban area, it brings with it more challenges.
I found when I worked in a rural area, the community was much more closer, and even if a client didn't have family to assist in their care, there was a neighbour or a very close-knit community nearby to help. I find sometimes in urban areas, a lot of seniors, for example, live alone, and they feel like they're isolated because it's such a large area and they don't know what services are out there. Sometimes there's so many services that they don't know which one to pick and choose from.
As a nurse working in a rural setting, the first thing certainly you think about is the constraints of geography and time that goes along with it. In order for me to do a postnatal visit, I had to drive to King's Cove, which is a 45-minute drive. 45 minutes back and probably 45 minutes there. So that's a good chunk of your day.
And there's also an opportunity, or more of a challenge, I guess, in an urban area for particular groups to become invisible. For example,